Hey everybody, this is Kane, healthcare organizer at Citizen Action, and I want to talk really briefly about pre-existing conditions. It's a phrase I've been using in previous videos and in other opportunities when we talk about the Affordable Care Act, and I want to make it clear why this is such a big issue. Pre-existing conditions, frankly, is a bureaucratic nonsense word. It just means you have been sick, you are likely to be sick or injured, or you have a history of being sick or injured, and because of which insurance companies discriminate against those people that have a pre-existing condition. I myself have a pre-existing healthcare condition, and this is not a small number. It's why we keep talking about this. 1.3 million Wisconsinites are discriminated against and denied opportunity and freedom by insurance companies who decide who is a good risk and who is not a good risk. 1.3 million Wisconsinites under 65. That is roughly 1 out of every 4 people has some form of a pre-existing healthcare condition. And the older we get, the more likely that we're actually going to get some sort of sickness or injury that's going to treat us differently by our insurance companies. These 1.3 million Wisconsinites, if they ever had to go buy health insurance on their own, would absolutely be denied or charged higher rates or discriminated against in some other fashion. My personal favorite is when an insurance company tells you that they'll cover everything but your condition. They'll carve out a little piece of this. This is a really broad, common issue. In fact, pre-existing conditions is the term used for a whole series of different conditions. Things like diabetes, arthritis, heart conditions, high blood pressure, hypertension, huge list that I'll put below this video so you can see what some of these are. But by the way, if you are interested in a particular condition, if you are concerned about it or have a history of it, and you're curious if it's a pre-existing condition and it's not on this list below, it's not because it's not one. It's because we literally ran out of space. In our PowerPoints, we've run out of space to be able to talk more about pre-existing conditions. But here's the worst part. It also includes such common issues as acne or pregnancy. And I think most of us have a family history of pregnancy. I think that runs in most of our families. Because here's the thing, we don't decide who has a pre-existing condition. This isn't up to us. We're at the low end of the totem pole when it comes to making the decisions and really arguing of who's making fair discussions when it comes to purchasing health insurance. And it's not just healthcare conditions. It's not just your medical history. Insurance companies find other ways to discriminate against you, charge you more, etc. And one of the worst ones is gender discrimination. Women, you are charged more than men for health insurance. And it's because of your gender. It has absolutely nothing to do with necessarily with your life choices, but because you as a gender are much more likely to use the healthcare benefits you're given, you're much more likely to go to the doctor. You also tend to get pregnant more. But besides that reason, women, you get charged roughly about 1.5 times what a male is charged. So a 22-year-old female pays about 50% more, 1.5 times, what a 22-year-old male will pay. But again, it has nothing to do with your life decisions. You could never get sick, never go to the doctor, never use your benefits, and you will still pay more than your male counterpart because it's based on your gender. Much like when banks and insurance companies would charge you differently for auto and home insurance based on where you live, it's the exact same way. So when it comes to health insurance, being female is a pre-existing healthcare condition that will cause you discrimination. This will be taken care of next year, and so in the next video we're going to talk about what comes next, what is about to start January 1st, 2014, and that's how we're going to deal with these pre-existing conditions, this gender discrimination, and all of these issues that insurance companies push on us. So thank you for watching. Like the video, be sure to comment with your questions below, and be sure to share this video with others so that we all see what is about to happen in healthcare reform in Wisconsin. Thank you.